Hi, I'm Dr. Sumanth Kumar Mallupattu. I'm working as a consultant in medical oncology at care hospitals. I am treating the patients with chemotherapy, immunotherapy, and many forms of targeted therapy. Just I want to share with you how to manage the side effects of a cancer therapy. So, cancer therapy usually encompasses three different varieties, that is surgery, chemotherapy, or a targeted therapy, and then a radiation therapy. I will be discussing what could be the side effects that are associated with a chemotherapy or any targeted therapy, and how we can effectively reduce or avoid those. For instance, for chemotherapy carries a mild risk of having some nausea, vomiting, fatigue. Patient may land up in infections. For this, we actually counsel the patient in that we give a very good form of antiemetics. These days, the antiemetics are so potent that the patient even doesn't vomit with chemotherapy. So there are these medications decrease the sensation of vomitings. These are given during the chemotherapy, post chemotherapy, so that the patient doesn't feel nausea or the fear of having a vomit. So, and another thing what patient usually complains of is hair loss. This hair loss, believe me, this hair loss is only temporary. As long as the patient receives chemotherapy, there will be a mild loss of hair, but not to the extent that they may go bald forever. This is true. So after the patient receives and completes the chemotherapy, the hair regrows to the normal level. Even with cryotherapy, when we give the chemotherapy, we give a form of ice over the head, wherein the cooling effect causes blood constriction and also decreases the blood flow to the hair follicles, and this decreases the hair fall. So there are many ways that where we can mitigate these side effects of chemotherapy, and even the patient may have low counts for this post chemotherapy. So to decrease the incidence of low counts, we give some form of growth stimulating factors. So all this increase the blood counts in the body so that the patient doesn't catch up any infection with chemotherapy. So most of the side effects that patients fear is these three. However, there are targeted therapy where patient may have mild diarrhea, little fatigue, inability to eat, but those are not so severe that they may cause debilitating to the patient. When compared to the benefit these therapies cause to the patient, the side effects are very, very little, minimal, and we can even decrease with many form of drugs that we give along with the chemotherapy. So it's always better to take when a physician or a cancer doctor advises for these forms of therapy. Please come discuss, and we will let you know the actual benefits of chemotherapy and its side effects. So and the ways that we can decrease them so that your cancer would have a very high chance of cure. Thank you.